Seeing without seeing? Can a blindsight patient have conscious vision despite being visually impaired? Now, good afternoon. I'm Marcus, and I'll be presenting this paper by Overgaard and his colleagues. So just a brief introduction to blindsight. Blindsight's a phenomenon in which a patient has a lesioned or severed primary visual cortex, either due to a physical injury or a brain hemorrhage, and that causes a lack of visual awareness, in other words, blindness. However, the patient is still able to discriminate visual stimuli in their blind field. So we see here in this sketch where there's a blind patient sitting down. He asks, "What line? I can't see a line." And the doctor says, "Well, just guess." And he goes, "Horizontal." And he's right. And so we see kind of this phenomena happening in many clinical and medical cases in different instances. And that has led researchers to conclude that the ability to discriminate visual stimuli is unconscious. But is that right? Because research so far from a few country studies have shown that there is some sort of correlation between visual discrimination ability and conscious awareness. So examples of patients reporting the experience of feelings or consciousness when presented with visual stimuli in the blind field. So is there such thing as a weak visual experience in blindsight? Well, there have been limitations to this area of research so far. Firstly, because binary methodology has been used in past blindsight experiments. So patients either say they can see or they cannot see. And perhaps this limits the detection of conscious awareness. Secondly, blindsight patients may actually have conscious vision, but perhaps they tend to set their threshold for reporting this consciousness too high. So the question of this study is blindsight best described as unconscious, conscious, or severely degraded vision? Now, let's jump straight into the methods. And here's the patient, a 31-year-old woman with a history of brain hemorrhage, and she had damage in her left occipital cortex, which led to blindness in her right upper quadrant field of vision. And experiment one was to document the extent of this patient's visual deficit. So there was a computer screen divided into 50 regions, and in each region, 3 letters were presented in a random order. And the patient was to indicate how many times she perceived letters showing up. And so here are the results. In red here are the regions in which she identified all 3 letters, or perceived 3 letters. In orange, where she perceived 2 out of 3 letters. In yellow, where she perceived 1 out of 3 letters. And in white, where she perceived no letters. So that lines up with a condition where she's blind in her upper right visual field. And so here, marked out in green, are areas for that the researchers set out to explore after experiment 1 for the following 2 experiments that we're going to be talking about. And so here, what they have done is mirrored the visual field where she had impaired vision onto her healthy visual field, being her left visual field. So experiment 2, the researchers explored the relationship between discrimination ability and visual conscious awareness using a binary report. So very similar to experiment 1, just that we're looking at the green regions now, and shapes were used instead. The patient was to report whether she saw something just by pressing a button. So whether she sees something or she doesn't see something. And then after that, she was to guess which shape was presented by a selection of choices provided right after 3 shapes were shown. For experiment 3, same thing as experiment 2, with the only difference being that the method in which she reports awareness is not a binary report, but instead a perceptual awareness scale that the researchers have created, where she indicates whether the shape was clear, almost clear, a weak glimpse, or whether the shape was not seen at all. So 4 options instead of 2 options, and non-binary. So results. For the binary report, that lines up with previous research in which the impaired visual field had shown no significant relationship between experiential clarity, or being the ability to see, and the accuracy of identifying the shapes rightly. So there was no significant relationship found. In the healthy visual field, there was a positive relationship, as expected. And so this proves previous research. However, when the PLoS was used, the perceptual awareness scale was used, significant positive relationships were observed for both the healthy and impaired visual fields, where experiential clarity or consciousness had a relationship with the accuracy of identifying shapes, or in other words, visual discrimination ability. And so this suggests and gives evidence to the idea that awareness, when properly assessed, is likely to be predictive of accuracy or the visual discrimination ability in blindsight cases. And also might affirm that blindsight patients perhaps tend to set their thresholds for reporting conscious awareness a bit too high. It also says that PASS is more sensitive of measure is more sensitive measure of conscious awareness than just having binary reports. And this leads to a key idea that perhaps the ability to discriminate between visual stimuli might not reflect unconscious vision, but rather degraded yet conscious vision. So this has implications. Firstly, more evidence is needed to support these claims, as blindsight cases are rare, and this is just a study on one woman, so perhaps we could look into animal research. More importantly, though, if this is true, there needs to be a reconsideration of previous methodologies and results obtained from studies on blindsight and normal vision, because most people conclude that vision is unconscious when it actually could be conscious. And finally, non-binary forms of reports, like the perceptual awareness scale, should be preferred for future visual studies on consciousness instead of binary reports. So that's it for today, and thanks for listening.